Hi, my name is Dulce Garcia and I work for a health maintenance organization. And one of the companies that we're contracted with has informed us of a growing expense that they're going through. This is a large energy company in Houston, and they're having a lot of employees who are under hypertension and cholesterol medications. And so, of course, one of the problems is that they're having to pay for it. So, going off by my introduction, I'd like to acknowledge the nutrition problem, which is hypertension and cholesterol. So, of course, like I said, lots of these employees are under these medications, and it's very unbeneficial to the company because at the end of the day, they're having to pay for the medications. And so, just a little background information about hypertension and cholesterol. Patients who usually have this is because they have a poor diet, lack of knowledge, usually lack physical activity, and are usually overweight and obese as well. But the good thing with these type of medical conditions is that they can be reversed, improved with simple lifestyle changes and even a diet. And so I think it's very important that I acknowledge some of the short-term and long-term consequences of these medical conditions, because not only is it affecting the patient but the company as well. So some of the short-term consequences can be dizziness, headaches, lacks of concentration, which is bad because it's not only affecting the employee but it's also affecting the coworkers and the company itself, because the employee is not being able to be as productive as they can. And of course, all small things lead into bigger things. So some long-term consequences can be even more serious health illnesses such as kidney disease, eye problems, forms of dementia, strokes, or potentially even death. So at the end of the day, the patient's not willing. The patient nor the company is winning, because the patient is sick and the company is still having to pay for these medications. And so I started looking into some other organizations to see what was kind of out there, and I came across other ones such as Total Care Wellness and Centers for Disease Control and Prevention. And these were great programs, except they all require the patient to go out and do all their screening, blood work, assessment, physicals, and all that to other clinics. And so I thought instead that we can get the energy company to have their own healthcare professional within their own building. And so they would come in 2 to 3 times a week and basically just implement ideas on how the employees can improve their diet, become more active, and most importantly, build a program of support. And so they'll just be trying to find ways to get the employees more involved by making them participate in fundraisers, changing the vending machines, offering incentives for those who park further, who walk, who bicycle to work, and always offering them incentives just to keep them motivated. But also, one of the things that we should take into consideration is multicultural and diversity issues. So that's why a healthcare professional works really well, because that way the employees are able to set up appointments where they can talk to them one-on-one, just in case they need a little more help with their own personal issues due to religion, culture, or etc. And so, of course, we would have to be able to evaluate our plan. And so we would do this by measuring employee participation, feedback, changes in their lifestyle behaviors, if there's a reduction in healthcare costs, if there's a decrease in number of sick days. And we would measure this before we start the project, 6 months into it, and at the very end.